So if we go back to the Klein years and with reference to bumping, so for those of us who are around, he really slashed and cut the healthcare budget. And so there was job loss at that time. By the way, there was a promise that there wouldn't be job loss if we took the wage cut. So we took a vote and the membership decided we would take the wage cut to save the jobs. And then we also lost the jobs. So what happens when jobs are eliminated is a process called bumping. It is within the collective agreement, and it is you could look at it as your job security, and we also work on the basis of the concept of seniority. So if you're a more senior nurse, meaning you've been around, hired for, let's use 10 years, for instance, compared to someone who's been 5 years, the 5-year person loses the job, the 10-year person stays. But perhaps the 10-year person position is eliminated. The person can still stay in the system, but they have to find a different job, so they bump. And what that means is they look at all the empty spaces that have been created with the cuts and the job loss, and they, by seniority, choose where they go. So you could have been a labor and delivery nurse, and now you're looking at your options. Your option could have been a medical unit, emergency room. So sometimes people will look at bumping as it's the lottery. I get to finally go where I want to go. And other people look at it as I love my job. I don't want to go anywhere. So you've got two situations happening. Regardless of that, you have to make a choice to either choose a vacancy or you can bump someone less senior than you. So if you look at the vacancies and you go, I don't want to work in emergency, I don't want to work on that medical unit, I'd rather go somewhere else, you are bumping someone less senior than you. That means you're taking someone who may be truly love their job, has good working relationships with the other nurses and nursing aides and healthcare assistants and the unit clerk, the whole system, and you're removing them and you're putting yourself there. So it's not an easy decision, but it's the only decision we have if you want to keep your job. So this nurse has the moral distress of knowing, I don't want to leave where I am, but I have to, so I might as well choose somewhere I like to go. And they also have the distress of knowing they're removing someone from their job. So that's choice number one. This person gets the knowledge that they're losing their job, and if they're so lucky to still have some seniority in the system, they can bump someone further down the line. But what it causes is the person from labor and delivery who goes into whatever unit, the people who are left there may have really liked the person who got bumped. They had relationship. They had community. There was history. And so what does human nature often do? Dislikes the person who made the choice to bump into that. And so there's tension and friction. And I know from conversation that I had just recently that tension and friction that happened in the 90s during the Klein era, where bumping was rampant, is still affecting certain people. There's still resentment and animosity and tension. And that is unfortunate because when you are in work, rest, or play, you want to be fully enjoying and fully engaged with what you do and with who you do it, i.e. your coworkers. So that bumping is in our collective agreement to help us keep our jobs when there's been a reduction in the workforce, but it is a very painful and difficult process, and it causes great angst. Mm-hmm. And it is it can really adversely affect relationships moving, 15, 20 years down the line.